Hi, my friend. I want to explain about the disease that we can find completely from echocardiography. The first disease is ASD. What is the ASD? It is an atrial septal defect. Is a hollow in the heart between the upper chamber atria. The hollow increases the amount of the blood and flows through the lungs. The condition is present at the birth. This is the congenital heart defect. In fetal, the circulation blood in heart is different. So the wall of atria, left atria and right atria grows and come to get. After the birth, the baby, we must have not any hollow and shunt of blood between right atria and left atria. If we have a small canal, we say this canal PFO, and if it is bigger, we said ASD, atrial septal defect. In ASD, the blood flow from LA goes to RA because the blood pressure in LA and LV is bigger of blood pressure RA and RV. We have blood shunt, and we said left to right shunt. Left to right shunt. In this picture, we see the blood goes from LA to RA, and when we say left to right shunt. In a report of echocardiography, we have a term paradoxical motion, septal paradoxical motion. What is the septal paradoxical motion? In normal heart, when in diastole, the wall relax together, and the wall contraction in systole together. We say this if in diastole the wall go away from and together, and in systole the wall near together. If this is the septum, and if this is the free wall, we see in diastole the wall and the septum and the free wall relax, and in systole they are contraction. It is normal, and in this period we see contraction and relaxation, contraction and relaxation. In paradoxical septal motion, we see a paralyzed motion about the septum and the free wall. When the septum contraction, the the lateral valve relax, and when the lateral valve contraction, the septal relax. We say this item paradoxical septal motion. In AST we have paradoxical septal motion. For the first item, can we see in echocardiography we have a paradoxical septal motion. This is paradoxical septal motion, and this is the normal motion. And this is the paradoxical septal motion. They are paradise, but this is the normal contraction. It is maybe you must think about about the motion of the valve. In this is we see the paradoxical septal motion. This is the paradoxical septal motion, and this is MO. This is the septum. We see the when the septum contraction, the lateral valve relax, and when the lateral valve contraction, the septal defect relax. So we have the paradoxical septal motion. We see paradoxical septal motion in ASD, atrial septal defect. This is a ASD. This is a septal atrial septal defect. We see LA and RA, RV and LV. Because the shunt from LA to RA, left to right, we have enlargement, RV enlargement and RA enlargement. So for finding the ASD, we have the paradoxical septal motion and RV and RA enlargement. But we have a shunt in color and Doppler. We can see the in this view we see the shunt LA to RA ASD, and we see the shunt, and we can measure the size of ASD. To approve the ASD, we use the contrast echocardiography. I explained about contrast echocardiography in one video. Next, we have the ASD, and we agitate the saline, and the saline, we see the flow of the left atrium to right atrium. ASD may be secondary time or primary time, and maybe marginal ASD. In echocardiography, special transesophageal echocardiography, we can size the rim of halo and ASD for surgeon to that he can operated. By operated, we can cure the ASD, or by balloon and umbrella balloon we can cure the ASD. Goodbye. See you next time.